Hi, my name is Shauna Snyder, and I'm one of the acupuncturists at Integrative Acupuncture, and welcome to the On Point podcast. If you live with chronic pain, you may have noticed something interesting. Summer often feels a little easier on the body. Maybe your joints feel less stiff when you wake up. Maybe your back loosens up after being outside in the warmth. Or maybe old injuries don't ache quite as much as they do in the colder months. In traditional Chinese medicine, or as we call it TCM, this isn't just coincidence. Summer is actually considered one of the best times of year to treat chronic pain at its root. Instead of waiting until pain flares up again in the fall or winter, summer gives us a unique opportunity to work the body when it's naturally more open, mobile, and responsive to healing. Today we're going to talk about why warm weather can help chronic pain, how acupuncture supports healing from both Eastern and Western perspectives, simple things you can do at home, and why treating pain proactively during the summer may help you feel better long term. In traditional Chinese medicine, there's an old saying, treat winter diseases in summer. Many chronic pain conditions like arthritis, sciatica, old injuries, neck tension, and chronic back pain are viewed as cold or deficiency conditions in traditional Chinese medicine. That doesn't mean your body temperature is cold. It refers more to the patterns of poor circulation, stiffness and contraction, reduced movement, and pain that tends to worsen with cold or damp weather. In TCM, when circulation slows down, qi and blood stagnate, and when there is stagnation, pain develops. Summer is associated with yang energy, which represents warmth, movement, circulation, and activity. During the summer months, the body naturally becomes more expanded and open. That means it's often easier to improve circulation, relax muscles and connective tissue, reduce stiffness, and help the body release chronic patterns of tension and pain. In simple terms, your body tends to respond better to treatment during the summer. Now, why warm weather helps pain? Let me give you the Western medical perspective first, because what's interesting is that modern medicine supports many of the observations seen by an acupuncturist when assessing a patient coming in for chronic pain. Heat naturally improves blood flow, which helps deliver oxygen and nutrients to injured tissues. Warmth also helps relax the muscles and can reduce joint stiffness. That's why many people notice they move more comfortably in the summer months. Research from the National Institutes of Health suggests acupuncture may help chronic pain by influencing the nervous system, improving circulation, and reducing inflammation. The Mayo Clinic also notes that heat and movement can improve joint mobility and decrease discomfort in many chronic pain conditions. So when you combine warmer temperatures, improved circulation, movement, and acupuncture, it can create a really supportive environment for healing, and more importantly, the benefits may continue long after treatment ends. Over the years, acupuncture has become one of the most researched complementary therapies for chronic pain. A large review published in JAMA Internal Medicine found that acupuncture was effective for conditions like chronic back pain, neck pain, osteoarthritis, and other musculoskeletal pain conditions. What I think is important for patients to understand is that acupuncture isn't just masking symptoms temporarily. The goal is to help the body regulate inflammation, improve circulation, calm the nervous system, and support the body's own healing processes. And summer often gives us an ideal window to support those changes more effectively. One thing I see clinically is that many people wait until pain becomes severe again in the colder months before seeking treatment. But by that point, the body is often already more inflamed, tight, reactive, and guarded. It doesn't mean that acupuncture is ineffective during winter. It's just that summer gives us the chance to work earlier in the cycle. When symptoms are calmer, it's often easier to improve mobility, build strength and resilience, decrease inflammation, and help prevent flare-ups from becoming as intense later on. Instead of only chasing pain once it flares up, we can work more proactively and help shift the underlying pattern. During the treatment, our acupuncture practitioners may add therapies like cupping, gua sha, or demonstrate strategic stretches to aid in healing and provide relief from pain. It's also common for us to include herbal liniments like evil bone water, posamon, or medicated plasters in addition to the acupuncture session because it helps maintain pain relief longer between appointments. Personally, I like to use a combination of Epsom salt cream, CBD ointment, and posamon because these three together relax tense muscles, decrease pain, and promote blood flow to help heal damaged tissue. There are also traditional Chinese medical herbal formulas that we offer that help improve results even more. Our acupuncturists at Integrative Acupuncture in Williston and Montpelier can provide you with further information about these supplementary options to ensure that you're getting optimal pain relief that fits your unique situation. So now I want to share with you some quick tips that you can do at home. There are 2 easy acupressure points you can do to support circulation and reduce tension. Large intestine 4. This point is located between the thumb and index finger, and it's commonly used to help relieve tension, improve circulation, and reduce general pain. You're going to want to apply firm pressure for about 30 to 60 seconds on each hand while breathing slowly. Now, mind you, please avoid this point during pregnancy unless instructed by your practitioner. The second acupressure point is stomach 36, and this point is located about 4 finger widths below the kneecap, slightly to the right of the shin bone. In TCM, stomach 36 is often used to support energy, improve recovery, strengthen circulation, and help the body feel more resilient overall. Massage this point for 1 to 2 minutes daily on each side. Another simple tip is to keep moving gently throughout the summer to promote blood flow, allowing your joints to move smoothly. Walking, swimming, stretching, tai chi, or yoga can all help maintain mobility without overloading the body. So summer isn't just a temporary break from chronic pain. It's an opportunity to help change the pattern before colder weather returns. By working with your body's natural rhythms, acupuncture may help reduce pain more effectively, improve mobility and function, and potentially decrease seasonal flare-ups before they start. If you're living with chronic pain, now is the great time to begin treatment instead of waiting until symptoms worsen again. To schedule an appointment with one of our acupuncturists at Integrative Acupuncture, visit our website at acupunctureinvermont.com or just give us a call at 802-223-0954. Thanks so much for listening to the On Point podcast, and I'll see you next time.